Hi, you guys. Welcome back for our daily practice questions. It is day 90, and as always, I like to first begin with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. All right, you guys, and if you're looking to join this upcoming 5-week intensive review, be sure to click the link in the description. It starts April 21st and runs through May 30th. You will be finished by the end of May and ready to successfully pass your board exams. But also, as we are navigating on through the year, it's already the end of quarter one and we are rolling into April. Y'all remember why you started? Stop being focused on the hurdles that you have encountered and allowing it to delay you any further. Shake it off, pivot, and get back to it. No more excuses. It's time to push forward. But all right, let's get into question number one. Question number one states a 52-year-old male presents with sudden onset of severe pain, swelling, and redness in his left great toe, which started during the night. The patient describes the pain as sharp and rates it as a 9 out of 10. On exam, the toe is erythematous, swollen, and warm to touch. The patient has a history of high alcohol consumption and a diet rich in purine containing foods. Which of the following is the most likely diagnosis? Is it A, gout? Is it B, osteoarthritis? Is it C, rheumatoid arthritis? Or is it D, septic arthritis? Take a moment to tell me what you got in the comments, you guys. All right, y'all. So, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So, here the stem of the question states, which of the following is the most likely diagnosis? And y'all know what I always say, if they're looking for a diagnosis, you need to run it back and look at those assessment findings. Look at how they're presenting. What are their signs and symptoms? What is the chief complaint? What is noted on exam? And as I always say, with those assessment findings, pay attention to these three factors if they are provided: the age, the gender, and the ethnicity, as this can aid in how you determine these diagnoses or treatment options in some situations. So here we have a 52-year-old male who came in with sudden severe pain, swelling, and redness to his left great toe that started during the night. He rates the pain at a 9 out of 10, says it's sharp. And on exam, the nurse practitioner notes it's erythematous, swollen, and warm to touch. The patient consumes a lot of alcohol, high purine diet. Y'all, this is classic presentation of gout. The best answer is A, gout. All right, question number two. A 40-year-old male presents to the clinic with sudden onset of intense pain, swelling, and redness in his right big toe. The pain began last night and has become progressively worse. He reports that the joint feels warm to touch and the pain is so severe that he can barely walk. He has no significant medical history other than a high intake of alcohol and red meat. Upon exam, the right big toe is erythematous, swollen, and extremely tender. Which of the following medications would be the most appropriate for acute treatment of his gout flare? Is it A, allopurinol? Is it B, colchicine? Is it C, methotrexate? Or is it D, probenecid? Take a moment and tell me what you got in the comments, y'all. Tell me what you got. All right, so stem of the question here states, which of the following medications would be the most appropriate for acute treatment of his gout flare? All right, y'all. This stem of the question is partly the reason that I stress doing your stem of the question first, because this stem tells you everything you need to know. It says, which of the following medicines are the most appropriate for acute treatment of the gout flare? I always tell y'all, if they're asking for a treatment, look and see if the diagnosis has been provided. It has. They're letting you know he's having a gout flare. but also it lets you know that we're looking for the acute treatment. Now, even if they don't typically use that word with the way they're describing this, if they don't use acute or saying that specifically in the stem, if they're telling you it's a flare, it's an exacerbation, that is acute, right? So also pay attention to the terms, but remembering acute versus prophylactic treatment. So because this is an acute treatment, the best answer is B, colchicine. Read the stem of the question, y'all. All right, question number 3. A 55-year-old male with recurrent gout attacks is being considered for prophylactic treatment to lower uric acid levels and prevent future flare ups. Which of the following is the first line medication for long term uric acid lowering in patients with frequent gout attacks? Is it A, colchicine? Is it B, allopurinol? Is it C, prednisone? Or is it D, indomethacin? Take a moment to tell me what you got, y'all. All right. And so, again, similar question here states, which of the following is the first line medication for long term uric acid lowering in patients with frequent gout attacks? All right, y'all. So, let's just look at the scenario. We have a 55-year-old male. He's having recurrent gout attacks and he's considering prophylactic treatment to lower those uric acid levels and prevent future flares. So, they're asking which of the following is the first line medication to lower those. So, it's already told you that we're really looking for prophylactic treatment, right? So remembering that B, allopurinol, is the prophylactic management for gout. And I always say, think allopurinol has the word all in it. So British Brilliant says all because we use this all the time for prophylactic management, right? So make sure that you are not missing questions because you didn't pay attention to the type of treatment they're looking for. Do not miss questions because you're just going, oh, I know we treat with colchicine. Oh, I know we use allopurinol. But if they're asking for acute, you need the acute medication. If they're asking for prophylactic management, you need prophylactic medications, right? So, and I know this seems like, duh, girl, I know this, but when you are under pressure, you often make careless errors. And so I try to train you to practice and condition your mind and strengthen that muscle memory with these terms. And even though it may seem like the obvious, when under pressure, this will be so second nature that you're able to excel. Because when under pressure, you should still be able to successfully answer these things that you know and not get flustered and rush and mess up, right? No different than we do anything else in healthcare. When we're under pressure and treating and managing people, we have to know how to maneuver. Same thing when you show up on the exams, all right? All right, you guys, as always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, as always, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1 at gmail.com. Everything that I do offer is linked in the bio of this channel. And as always, if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.